Welcome everyone to the V3 implementation call. Today is March 9th. We are happy to have you with us this morning. Just a couple of housekeeping items. These meetings are recorded and we post them on our website and on our YouTube channel for your reference. If you miss a meeting or if you need to go back and see a section of a meeting that got really technical or in depth, those are available. And they're also time-stamped. Our talented Chris Hoffman makes sure that the videos on our YouTube channel have a timestamping so you can go directly to the topic of your interest. It makes it really helpful. Just a reminder that it's really helpful if you put your association or your affiliation next to your name in the participant list, especially if you're a vendor. We use that list to track participation. And also if you're a state or a national partner, it's helpful for other people on the call to be able to see who's talking and how they fit into the grand scheme of the EMS data picture. We do consider these meetings conversations, so please unmute or use the chat feature if you've got a question, a comment, something that you'd like to bring up to this large group. We have a lot of really talented, skilled, experienced people on these calls, and so usually when there's a question, there's somebody on this call that can answer or give a best practice, and we really appreciate the collaboration that you all have with each other and with us. So with that, I will move down to the agenda. Hopefully everybody can see that. I'm going to turn the time over to Jen Correa. She just has a short maintenance update for us. Jen?
Good morning. The maintenance for March will be on the nemesis.org site. March 15th. If it takes a little bit longer, it may run into March 16th. But it should be all complete and nobody should notice too much on the 15th. And that is it for maintenance.
Easy. Hey, Jen, would you throw in the chat the location where we keep the maintenance schedule on the website? I know we put it up there quite frequently, but just in case anybody's new or has forgotten where we keep that, sometimes it's helpful to know where that is on the website.
Okay, I will do.
Thank you, Jen. Next on the agenda, Lauri Bradt is going to talk for just a minute about the April training that we have coming up next month. Lauri?
Thanks, Julianne. I do just have a quick announcement and asking for some feedback today. On April 5th, we have our public training, and the audience for this is both state data managers as well as vendors. And the topic is going to be onboarding process, the onboarding process for version 3.5. And at this point, as we're preparing for that training, we would love to just solicit any questions you have at this point that you would like covered or answered during that training. So I have a questionnaire in just a moment. I'm going to put it in the chat. And if you wouldn't mind, just during this meeting would be a great time. If you have questions, no question is too big or too small. We would love to hear what you're wondering about, curious about, so that we can be sure to cover it at that training. And that is all I have. Back to you, Julianne.
All right, thank you, Lauri. We really do pay close attention to the questions that you all present, whether it's 3.5 or whether it's another aspect of implementing the data standard. The feedback and questions, comments that we receive from our stakeholders are carefully considered, and we really do appreciate your input on those. Next on the agenda, Ben Fisher has two topics for us. He's going to show us the state level EMS by the numbers dashboard, which is super cool. You guys are going to be totally excited about this. And then he'll go into the eDispositions flowchart. And not that the flowcharts aren't exciting, because they are. They just aren't quite as exciting as the dashboard. So Ben, you've got your work cut out for you for the next few minutes. It is all you.
Right, and if you don't mind, I will start sharing.
Yes.
All right. So hopefully some of you are familiar with the EMS by the numbers report. We publish this every week right now. And right now it is produced as a PDF PowerPoint. We've spent quite a bit of time developing a Tableau dashboard with the same information. It's available to state data managers. It does require a Tableau login. And it's available on the View Reports page under State Reports. You can see State EMS by the numbers dashboard. We are working on a companion document, user manual, like our other dashboards that should be available shortly. But you can click and log into the dashboard, and then tabs for rates for the same measures as the previous version of the report are available. So it is available at the state level as well as the national level. And then obviously state data managers, you'll just have access to your state. It does contain count of EMS activations, and we've tried to replicate some of the markers for the previous from the previous report. So you can see things like when the public health emergency first started, and then the shading represents as some lockdown measures were imposed, as well as some additional holidays that correlated to increases in ILI activations and ILI rates. The measures across the top, so these are the metrics we've been tracking, are ILI activations, pediatric ILI activations. So this was particularly of interest over the last year or so. Cardiac arrest activations, as well as scene death, injury and vehicle crash, because obviously these decreased pretty dramatically at the beginning of the pandemic, as well as opioid and naloxone related activations, and suicide, alcohol, and mental health and behavioral health activations. So these are all rates, and they are available now. And the companion document will include inclusion criteria, as well as the numerator and denominator for how these were created. So that is a very quick overview of these dashboards. We certainly welcome any feedback. If any of you have any questions, you can reach out to me or Kevin, and please let us know if you guys have any feedback for us. Are there any questions about these so far?
Hey, Ben, would you show them how they can subscribe and have these delivered directly to their email?
Yep. So that's a really good one. So if you'd like to have these emailed to you on a regular basis, if you click this subscribe button down at the bottom, you can enter your email, and you can specify exactly what you would like to receive, whether it's the entire report or the view, and you can receive it as a image or a PDF. And then you'll receive the email on the schedule that you set with this as an attachment. Anne asks, what's the best way to share these with some others at the state? I think if you downloaded them as a PDF, you can also download them using the download button as a PDF. Okay. Well, without further ado, we'll go into the flowcharts real quick. So we have added the flowcharts and incorporated some of the feedback we received from the previous flowcharts for the updated disposition elements. The flowcharts are now all on the website under using EMS data on the v3.5.0 revision list of resources. We now have PDF versions of all of the flowcharts that we produced on our website, and we have tried to incorporate some of the feedback we got from the last ones about making the dot a little bit easier to see, as well as some of the text a little bit easier to see. These three new flowcharts are now for a treat and refer or ET3-like disposition, and then a pronouncement or DOA both with and without resuscitation. So this would be this is without resuscitation, and then the following one is with. And then something to note is just nope, sorry, not this one. Anyway, we certainly welcome feedback. I have a feeling we will get requests for additional ones of these. I don't know that we can make a flowchart for each permutation, but we certainly want to hear about the ones you're getting questions about from your stakeholders If there is confusion, we're happy to either adjust these or make additional ones. All right, I think that's everything I had. If anyone has any questions, please let me know. I'll put my email in the chat as well. And then, yeah, let us know if you have any feedback about these.
Thank you, Ben. Especially when state and national partners, when you're able to log into the EMS by the numbers dashboard, since that is brand new in dashboard format, please let us know if you have questions, concerns, you're not sure what something means, or there'd be a better way to display something that you're interested in. Please feel free to reach out. We really value that feedback. All right, next on our agenda, Eric, do you have, it's your time for anything from the Office of EMS.
Thanks, Julianne. Good morning. I just have one topic this morning. In the past, we talked about the effort. I've asked the TAC to schedule a meeting with myself and Julianne and Jen with each of the vendors that we work with in the country. And we're working down through that list now. We've talked to several already. We have several scheduled, and we'll be doing that over the next month or so till we get to everyone. And we're getting some great feedback. I really appreciate that. Just for a heads up for the ones we haven't met with, we're always asking about what we can do better or things that we can improve and different things that we should be focused on. So that's just kind of the line of questioning, but there's no real format for those meetings. And we are going to be doing a summary out of that that we'll most likely be presenting at our annual meeting at the end of this year. Unless there's questions from me from the group, that's all I have for today.
Any questions for Eric? All right. Are there any questions, concerns, comments that anyone would like to bring up during open forum?
Hi, Julianne, it's Mark Roberts. Oops, sorry.
All right, there we go. Now there's only one Mark Roberts.
Now I'm having problems, darn it. Okay, are you there?
Yes. Yeah.
Okay, thanks. Hey, I just wanted to find out if we can get some clarification. We're running into a problem in California. I don't know if any other states have ran into it with concern about a vendor being classified as middleware. And if anybody else has ran into that, but I think we need to have if not now, we need to have kind of a discussion as to where the term came from and exactly how it applies versus a collect data or receive and process. So that we don't have somebody doing scope creep and trying to circumvent the system. So I want to make sure that we're all on the same page because it kind of caught us in California off guard.
It's a good topic. Thanks for bringing that up, Mark. Eric, do you want to chime in on that? Do you want me to take that?
I know we had some questions earlier in the year, and Pulsera was particularly the vendor that was discussed in this particular case. And we didn't put out a formal letter or anything. I guess we can go back and revisit that. When I spoke to the state directors, I think that was like 18 December. I know we had a PowerPoint in there and we released that to everyone on this group as a part of that whole presentation. That basically the line in the sand, we drew that line as if you are collecting data and, we compared it to CAD systems and we compared it to the monitors and other things that collect data and send it to your EPCR report. That was I don't know that was the definition of middleware that was assigned to it. That term might have got assigned to it, but that basically it's the NHTSA's position that we do not compliance test those entities, the cardiac monitor vendors, the CAD vendors, the Pulseras of the world, so on and so forth. That line was simply placed at if they started to directly submit data to the state on behalf of the agency or whatever, then that's where they've crossed the line and they would have to be treated as an EPCR vendor, so to speak.
Is it
So
possible to put a number of elements, like, most of these that you just mentioned collect a handful, maybe 20 to less than 30 elements, right? And so it's not in any fashion a completed PCR at any way, right? Versus somebody who's collecting an entire PCR and then trying to submit it. That is not middleware. So, I mean, maybe if a definition was just like you said, spelled out, EKG monitors, CAD monitors, somebody who's collecting a minimal amount of data elements, example, under 30, whatever. That might be considered something along the lines of middleware. But when you get into a complete PCR, then that's when it's no longer there and it goes into the normal process. I'm just trying to see if we can.
Oh, I completely agree with what you just said. When the complete PCR is straightforward. I think the other piece to me that was pretty straightforward, and this was my understanding, at least in the cases that were presented to us, is that these vendors, and there, I mentioned Pulsera, there's others out there, were collecting data. That data was in some cases going to the hospital, in some cases going to other places, but ultimately ended up back to the individual completing the patient care report, then for submission into this system to go to the state. So basically, the data collected in the field hit the electronic patient care report, and then it was subject to all the schematron rules and testing, and then it went from there to the state, where it was subject to the state level schematron rules and testing, and then to the national. Are you telling me now that that's not the case, that there are vendors that are collecting that data and submitting it directly to the state, acting as an EPCR vendor?
Well, yeah, and we can have this conversation offline. I fully support what you're saying in terms of like the EKGs, under a certain number of elements, even hand TEVI, they're another one that is, they don't collect every field. They could never be certified because they only collect a small portion. They don't do the whole thing. But when you actually get into a vendor that is collecting data, then wanting to process the data and then submit the data, that's a whole different ballgame. And so I just want to make sure that maybe if we had some clarification, we wouldn't have somebody do this.
Yeah, I guess I'll ask the question, and I've asked this to a couple of the vendors that are doing this, and I've asked this to other folks. I get the cardiac monitor thing that's collecting information, sending it out as data to be included in other reports and such. I don't get the additional front end collection pieces.
Well, because they're going to certain, like Pulsera, for example, and I don't want to say that I fully understand their application, but they're collecting a specific number of elements that are then being transmitted to the hospital and going to certain teams to activate and things like that. And I mean, I see that there's value there, and that's fine. But they're being imported, that data is being imported into a certified PCR vendor who then is submitting the data and saying that everything that's contained within that PCR they're submitting has gone through and met all the NHTSA certification. That's why I was saying if we said, approximately 30 elements or something like that, then we would avoid the scope creep, because today they're 30, next week they're 50. Now all of a sudden they're 100 and they've just snuck around the system. And I'm not that way. There's nobody at all. I'm not pointing the finger towards anybody. I'm just saying I can see that happening because everybody, their customers are saying, well, could you add this field? It would be better if you just add it. Could you add this field? The next thing you know, the thing has just gotten out of sight.
But that's the part I don't understand. That's the part, Mark. And look, I agree with what you're saying. So far, we're on the same page. I guess I don't understand. So we've got one cat, and he's out there documenting, or she's out there documenting the call, right? Are they documenting it in their EPCR or in the other product?
The other product.
So why?
Well, and see, there's a whole nother deal. So maybe Eric, so in the time, not to keep everybody involved, I just wanted people to know that this was going on. Maybe we could have a conversation and we could get a little more specific, because we do have a vendor now that is doing 100% PCRs, who is also saying that they are middleware, and
that we can clear that. I think we can clearly address, Mark. I'd have to look at the circumstances, and we've not talked about that, but that we can clearly address.
Okay, so yeah, I'm gonna make myself available to you anytime you want to talk offline. I'm sorry I took the meeting over you guys. I appreciate.
No. We have plenty of time, and this is what this meeting is about. It's fully about these types of discussions. I want to encourage it. I don't want you to think I'm trying to stifle it. A part of me, just from and look, it's been a little while since I've been in the field, fully acknowledge that. However, I know it's difficult enough to get people to document things one time, let alone doing it in two different systems. And then to have two different systems, to me, just seems cumbersome to start with. My concern in just where this is going is, it's clear in the second example you give, if you're collecting this data and you're holding yourself out to be something other than an EPCR vendor, and you're acting as an EPCR vendor, then we're going to step in there because it's not fair to the other people on this call. Clearly, that's taking advantage of a loophole and trying to do something that you shouldn't be able to do. The part that scares me in the first example you gave is I'm always aware of the federal government stepping in to deal with an operational issue, and it sounds like, and we'll just pick a service. We'll say, the Clear Spring Volunteer Rescue Company decided they were going to buy software X because it did some really cool, neat things. And it sent some data to our hospitals and maybe our 911 centers. It maybe had a CAD piece to it or something. And we're going to enter data into that. And that's going to populate our EPCR system. And then that EPCR system will function the way it normally does. They're NHTSA compliant, and that'll be what sends the data to the county and then to the state and so on. In that scenario, I'm concerned, and when I talked to the attorneys early on and when we started having discussions about this, we have very limited control. It's not until you get to scenario 2 where the vendor actually steps in and is acting as the EPCR for that particular entity that we can say, hey, this really doesn't meet the whatever definition of the term you want to call it. You're acting as a vendor. You should compliance test like everybody else, and the state should look at you and say, hey, look, why aren't you doing this? I mean, I have to go back and look at it a little bit more specifically, but with the examples that you and I'll talk offline, and we'll put something together. And if we need a formal letter from our office to go out to specific vendors or just in total, we will do that as well. But
I think what I would appreciate, Eric, is the support of NHTSA, because the states are working really hard to support NHTSA and all the efforts and all of its protocols and everything in its standard. And so as a state, to have NHTSA support us and go, no, that's not right. We're not going to allow that, because we're kind of caught in the middle, right? Well, the vendor says this, NHTSA says this, and the state is saying this. We really need the support of NHTSA one way or the other, because we're trying to support you as well. So it needs to be a really good partnership. And I think it has been, but every once in a while it goes high and to the right.
Yeah, totally agree. There's always someone. It's just like your ambulance service, man. There's always someone out there that wants to try to get around there's an easy way out, or circumvent the rules or whatever. So, we've been doing pretty good for a while. We haven't had that. So, it's time again. So yeah, Mark, I will reach out to you. We'll set up a time, we'll have a conversation, and we'll draft something and put it together. And then we can put it out to this group and the data managers and have them take a look at it and see if it meets their needs. But it sounds like it's time for some kind of formal response to kind of bring this to a head.
Thank you so much. I really appreciate it.
Thanks, Mark. Thanks, Eric. There was a question in chat. Chip Cooper is looking for a document that CMS put out a little while ago. I'm wondering if this is related to the data collection for Medicare and Medicaid billing that some agencies were selected for. Does that sound right to anybody else? Is that striking a bell? All right, I'll look into that a little bit, Chip. There's something that's tickling the back of my mind that I might know what you're looking for, and we'll see if we can't find that. And if any of the other state data managers or vendors are familiar with what Chip is looking for, please reach out and let him know.
I can do more digging. If somebody said like, oh yeah, we're helping our services with that, it's called blah, 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 blah. Fine. I've got it stored somewhere. I just don't remember where, because it's been probably 2 or 3 years since I read it. And now they're enforcing it and making services reports. So
yeah, Chip, this is I know the document you're talking about, because I came into that late in the game and actually started before it. And when I reviewed it, I had some real concerns about it as well. But yes, they've started enforcing it for a portion of the ambulance services in the country. And I think next year they enforce it for the other one. I have all the documentation on it. I just have to go back and pull it up out of the file, but we'll get it to you.
yeah, I just need to know what the reports weren't really complicated, but they are if a service is trying to build them themselves. We were just trying to build them as a state to say, here you go, guys, just click run and you'll get your data out. But I haven't looked at the specs for a long time, so I need to go back and
be
find
careful saying that, because if I recall correctly, that was one of my big angst right up front. Was it wasn't just NHTSA specific. It was larger in scope.
Yeah, there may be some other things, but there was a lot of stuff that they could pull out of their UPCR system.
Most definitely.
Trying to make it as easy as possible for them. And these little services are having some serious angst about trying to figure out how to do that.
Oh yeah, and I think some of it is I'm sure some of it. In my mind, when I reviewed it, and Dr. Kramer and I had a couple calls about it, just him and I in discussions. It was like, look, some of this is pretty laborsome, and it's not necessarily collected, especially by the smaller, and I won't say rural, the smaller, less lower call volume services. I mean, there were times and monies or something to be projected, and there really wasn't a good formulas for some of this. So it really was up to the person completing it as to what their interpretation of some of these things are. Now you're refreshing my memory. I actually had a call with them and discussed some of this, and they were like, well, we vetted this through whatever and whatever over the period of I said, I don't know who looked at it, but I can't imagine folks like AAA and others looking at it and not just going high and right. But let me get the information for you. If you have questions of us or the CMS folks doing it, we'll get you a point of contact.
Yeah, I appreciate that. Just trying to help our folks out.
Yeah, like I said, if I recall, that they're going to need it.
And Jay asked in the chat if we'd share that out with this group, and we're happy to do that.
Oh, absolutely. Whatever we send, Chip, we'll send to the whole group.
Okay, awesome. Any other questions, comments, concerns for open forum?
I have a real specific question.
Sure.
Customer brought this up this morning, so this kind of timed out right. So I said, well, since you asked it and I got a NHTSA meeting, I thought I'll bring it up to everybody. This is about eSituation 0.07 and 0.08. These are chief complaint location and chief complaint system. And the question is marking these two fields not applicable versus not recorded. And the situation is you go to a call and on scene and there is no patient. What is there is not applicable or not recorded more appropriate than the other? Does it not matter? Is there an official NHTSA stance on that? Is there just a popular opinion? What would be the better answer there?
I don't think we have an official stance on that. Maybe another state would want to chime in on what their best practices for a no patient contact on not applicable or not recorded. The biggest concern that we always promote is consistency within the state for your own QA, QI, and research, so that some agencies are doing it one way while some agencies are doing it another. And then when you try and look at that data, there's inconsistency between those fields. Other than that, are there any state data managers willing to talk about what your practice is for that?
I believe not recorded is supposed to only be filled out automatically by the software when it's left blank, correct? That shouldn't really be a choice for the person.
Yeah, if you have no patient contact, not applicable makes sense. Not recorded, unless the system automatically goes to not recorded, that part would make sense. But it's certainly applicable to say if there was no patient found and there was an incident at that location, not applicable to me would be the appropriate choice.
In the extended data definition for version 3.4, I want to say it even said that not recorded shouldn't even be a choice that the units or the medics can make, that it should be something just for the software vendors to use. Like you said, if the field is blank, then it fills it in with that. So when you see a not recorded, you know that basically it was left blank or the software vendor filled it in order to have it pass Schematron.
Yeah, that was something that came out through NHTSA. I think, I don't know if it was this group or Data Manager Council, and NHTSA came out with that guidance a number of years ago. I'm not sure where it's parked, but the agreement was, like you said, Mark, that the not recorded wasn't even supposed to be exposed to the user. They were only supposed to see not applicable, and not recorded was going to get filled in the background into fields that needed to have a value in there, but were left blank by the user. So that's what I done in my state. I took not recorded off anything that was available to expose to the user right out of the system.
Same, Chip. I did the same.
And this is Kathy here in Georgia.
In the chat that has that
Yeah.
decision.
Yes, thank you. Thank you, Frank.
And this is Kathy in Georgia, and the same as what Chip and Eric said. We do not allow our agencies to even have the option of not recorded, because that, in our opinion, that falls back to the medic being lazy and just not documenting something. So we require them to actually use not applicable. And anytime we have an update, we reiterate that to our agencies as well as to our state vendors, that the medic should not have the option to document not recorded.
There's also, thank you so much. Thanks for everybody for pitching in on that. And Frank, thanks for putting this guide up there. There's also another simple document that we put out for, let's find it if I can, that just explains the not values. Let's find where that is. There we go. And I'll throw this one in the chat as well. And Troy Whipple from Image Trend also put the page that it's on the 3.4 data dictionary as well.
All right, just want to kick in that those are really great answers, and I appreciate all that information. That's going to help me explain it to the customer really well. And thank you, everybody.
Thanks, Jeff, for bringing that up. I appreciate that.
Jeff, if we missed something or they come back with additional questions, it doesn't work, or what we're providing here, and these documents Julianne is sharing with you, that's what they were developed for. Let us know and we'll get you whatever you need.
I'll let you know, but I think just the fact that it won't be me saying it, this is what NHTSA and different state managers say it. I think that's going to be a big enough hammer to get the answer across. So I really appreciate this all.
Yeah.
Hey, just as an aside, since you said that, so this year we've been asked to do some presentations at a couple different vendor conferences, and we're focusing on something because there's this running joke between myself and a couple representatives, actually from different vendors, is that, and Jeff, you just hit on it perfectly. Like, whatever the problem is, it's either you, the vendor's fault, or me, NHTSA's fault. It just depends on who's in the room and who's asking the questions. So, man, if it works out for you to blame us and get your point across, please do. We'll support you 100%. Just shake your head and say, well, NHTSA said that's what we have to do. and we'll go with that. But make sure we know what to support you on when you're doing that.
I'm blaming everything that we didn't get in 3.4 that we wanted on the change to 3.5, even if it has nothing to do with it.
Well, heck, Mark, since you brought that up, I'll scare the life out of you too. We have 86 requests for 3.5.1 or 3.6 already. So we can just add it to that list.
Yeah, I mean, bring it on. Bring it on. Retirement will be just funny as heck to listen to all this.
Eric, so the real question is, how many of those requests are based on or a result of someone not having read the 3.5 data set yet?
You know, Chip, I have to go back and look at it. At some point here, when we get a little further down the line and things calm down a little bit more, we'll send it out and just say, hey, look, kind of as an aside, here's what people are talking about for, down the line in the next version. I will tell you that none of them are from the TAC and none of them are from our office. So far, these are just things that, as people have started to look at NHTSA data, and Julianne and them can tell you the number of the public data sets or the research data sets that we've sent out last year, I think was close to 300, as opposed to the, like 50 or 60 that we used to send out. The number of agencies and folks that are looking at using this data, we're almost victims of our success. And, it's a great thing. It's what it was developed for. There's so many opportunities here now. It's just how to capitalize on it. And the piece that I keep really focusing everyone on is, hey, wait a minute. The person gathering this data is not working in a pristine environment, is often working in an unsafe or unfit environment. They're doing it very rapidly. They're educated. I don't want it to sound that way. They're not epidemiologists. They're not there for the purpose of data collection. And they have a very limited time to work in to collect that data. So I keep pushing it back, is that you can't keep putting additional expectations on people just to collect additional data to meet a research project's needs or to meet someone's specific needs. That seems to be the big pushback right now, that and how to make these changes to different versions. And that's one of the questions I've asked in our one-on-one vendor meetings too, is, hey, how can we improve this to make it more agile, make maybe minor changes more frequently, maybe tie it to compliance testing. Anyhow, we'll talk about more of that when we meet one-on-one, but completely hear you. I'm just, I want everybody to know what's going on. And I promised Joe Schmieder and Steve and Andy at the time back in 2019 when I took over this project that I would be as transparent as possible. That's why we do the monthly report and keep all this out in front of everyone. And that's just where we are today. So thank you all. I really appreciate the work and time that you put in this. This is really a humbling task to be responsible for, let me tell you.
Great discussion. Thank you, everyone, for contributing. We appreciate that. Any other items for open forum, questions, concerns? All right. Our next meeting is March 23rd. We always hold the V3 implementation calls on the second and fourth Wednesday. The connection information is also the same. So if for any reason you are not getting the Google group messages, feel free to use the connection information from previous meetings. We will try and our goal is to keep that connection information the same for the whole year. We'll only change it if we absolutely have to, and then we'll let everybody know that it's a new link. And I think, last thing to promote, always promoting, is the NHTSA annual meeting and boot camp, August 21st to 23rd. We are close to having registration open for that. We're just trying to finalize fees and hotel and some of the options that we want to be able to offer our stakeholders when registration is open. So we'll let you know about that as soon as possible. That will be in person in Park City at the Deer Valley Resort again. So we're super excited to have you back in person. For everybody that is able to travel, we will have a virtual option, and we'll keep you posted on that as well for those who are not allowed to travel yet. And with that, I think we are done for the day. Kind of a short call, and we appreciate your input, your comments, coming off mute and using the chat. It's really helpful to everybody on the call. Thank you for taking time out of your busy schedule to be with us, and have a great day and be safe out there. Thanks, everyone.